Hello and welcome. Thank you for joining us. This is from the CBN. I am Uliye Misidada. The popular saying, health is wealth, indicates that good health is the most valuable thing in our lives as individuals, and it takes a healthy workforce to make a wealthy nation. Poor health can reduce an individual's savings and income. Health is a stock which has potential effects on future income, consumption, and medical expenses. Today on the program, we'll focus on the economic intervention initiatives of the Central Bank of Nigeria in the healthcare sector, particularly the policy response of the Apex Bank to the coronavirus pandemic, which has had and is still having far-reaching effects on the world economy. Plus, what changes the people say they would like to see in Nigeria's healthcare sector. That's in the Vox Pop segment of the program. But first, here are the top stories from the Central Bank of Nigeria this week. Governor of the Central Bank of Nigeria, Mr. May says the bank has been able to create wealth among smallholder farmers in the rural communities through the collective efforts of key players in the agriculture sector. Speaking at the unveiling of maize pyramids and the flag-off for the 2021 maize wet season farming in Katsina State under the CBN May and Anchor Borers program, Mr. Mefele called on Nigerian youths to embrace agriculture as a means of making money.
I am saying today that our objective is to make agriculture a sexy business for everybody. And you know, when you say you have a sexy business, the youth have to embrace sexy ideas. We seize the opportunity to encourage the youth to come and join. We have various programs that you can benefit from at the Central Bank of Nigeria. Don't sit and wait. You can make money in agriculture.
The Central Bank of Nigeria says this year it will partner with the Institute for Agricultural Research, Zaria, to work on improved seeds that can produce higher yields per hectare. Director, CBN Development Finance Department, Mr. Ila Yusuf, told reporters at the unveiling of maize pyramids in Katsina last Thursday that the bank has also been working with state governments to provide land.
Absolutely. We've been working with the state government to provide land, but most importantly is partnering with the research institutes. The research institute in Zaria has just recently released a seed that can do 8 metric tons per hectare. We typically do between 3 and 5 metric tons per hectare. So we're going to be partnering with them in 2021 to look at how we can multiply those seeds and then eventually use the same size of land to double output. So we're partnering with all the stakeholders in the maize agri space, not just the research institutes, but also the seed suppliers, Seedco, Value Seeds, and others who provide seeds to the various farmers, to look at how we can improve productivity, which is one of the key things that the governor has asked the development finance team to really do in 2021.
The Central Bank of Nigeria, in collaboration with the International Institute of Tropical Agriculture, IITA, government agencies and private firms have moved to stop the rejection of crops produced in Nigeria by other nations. This move was disclosed in a communique issued at the end of a workshop organized in Abuja aimed at sharing results of aflatoxin levels in maize samples nationwide. The workshop was also to prompt concerted efforts towards the adoption of appropriate technologies in crops, food, feeds, and livestock as required by global food quality standards. This is expected to help achieve zero rejection of commodities exported from Nigeria. Aflatoxins are harmful toxins produced by certain fungi that are found on agricultural crops such as maize, peanuts, cottonseed, and tree nuts. Their presence on some grains grown locally has led to the rejection of this agri-produce in the international market. The CBN has called on business owners in the southeastern part of the country to take advantage of the bank's credit facilities and intervention initiatives to grow their businesses, especially those into agriculture, small and medium-scale enterprises. Acting Director, CBN Corporate Communications Department, Mr. Osita Onwanisobi, made the call during a 2-day sensitization fair which held simultaneously in Enugu and Anambra states last week. Themed Promoting Financial Stability and Economic Development, the fair was also meant to educate the public on their rights as consumers of financial services. Onwanisobi stressed that the CBN intervention initiatives and credit schemes are open to every eligible Nigerian who need not know anyone in high places in order to benefit. The Central Bank of Nigeria has announced that its Naira for Dollar scheme will continue until further notice. The scheme, which was originally meant to end on May the 8th, was introduced to drive diaspora remittances by paying 5 Naira for every $1 received through CBN licensed international money transfer operators (IMTOs) as remittance inflow. The CBN Trade and Exchange Department says all aspects of the operationalization of the scheme remain unchanged and has directed compliance from deposit money banks and the international money transfer operators.
Up until a few years ago, Nigeria produced far less than it consumed, spending up to $22 billion annually on importation. Then came the import policy by the federal government. Now, to survive, the nation must learn to be self-sufficient. And so far, we are on the verge of achieving this through the intervention of the Central Bank of Nigeria and other stakeholders in support of local farmers and efforts of value chain entrepreneurs. Now, the goal of creating 10 million jobs in 5 years through 10 commodities is gradually being actualized. Let's buy Nigerian to grow Nigeria.
If you're just joining us, this is from the CBN. Last Friday, we were at the premiere of Unmasked, a feature documentary on leadership trust and the COVID-19 pandemic in Nigeria. The event had in attendance dignitaries from the public and private sectors, including the governor of Lagos State, Mr. Babajide Sanwo-Olu, who was the special guest of honor. In his keynote address, Governor of the Central Bank of Nigeria, Mr. May, who was represented at the event by the Acting Director, CBN Corporate Communications Department, Mr. Osita Onwanisobi, commended the producers of the documentary, Ms. Kadaria Ahmed and Mr. Femi Odubemi, for focusing on infrastructure in the healthcare sector, the development of which is vital for the progress of any society. Mr. Emefiele said the onset of the COVID-19 pandemic in December 2019 brought to the fore the strong linkage between public health and economic growth.
Nations all across the world, with the exception of China, witnessed unprecedented declines in growth in year 2020 due to the rapid spread of the virus, along with the imposition of containment measures that were designed to slow down the spread of the virus. Policymakers across the globe were faced with a dual challenge of trying to address a public health challenge, which has so far resulted in over 155 million infected cases and 3.2 million deaths worldwide, and at the same time working to reverse a significant downturn in economic activities. In Nigeria, we were faced with both domestic and external spillover effects as a result of COVID-19 pandemic. First, the over 60% decline in oil prices in the first half of the year affected our foreign exchange earnings as well as government revenue. In addition, key sectors, particularly those that were contact-facing, such as hospitality, education, transportation, tourism, and trade, witnessed significant declines in growth. A culmination of these factors resulted in our economy falling into a recession in the second quarter of 2020.
He said the strong coordination from both the monetary and fiscal authorities led to the emergence of the Nigerian economy from the pandemic-induced recession in the fourth quarter of 2020, with the Apex Bank providing assistance to households and businesses most affected by the pandemic, as well as improving the capacity of the healthcare system to respond to the crisis and ramping up efforts to build a sustainable healthcare infrastructure that could anticipate and respond adequately to a potential health crisis in the future.
As a result, we focused our interventions in the healthcare sector on 3 areas. 1. Building the capacity of our healthcare institutions, supporting the domestic manufacturing of drugs by businesses, and 3. Providing grants to researchers in the medical field in order to encourage them to develop breakthrough innovations that would address health challenges faced by Nigerians. In this regard, we disbursed over 83.9 billion in loans to pharmaceutical companies and healthcare practitioners, which is supporting 26 pharmaceutical and 56 medical projects across the country. We were also able to mobilize key stakeholders in the Nigerian economy through the COVID Alliance, which led to the provision of over 25 billion in relief materials to affected households and the setup of 39 isolation centers across the country. These measures help to expand and strengthen the capacity of our healthcare institutions to respond to the COVID-19 pandemic.
The premiere, which was sponsored by the Central Bank of Nigeria, is another way the Apex Bank is supporting the creative and healthcare industries in the country. Now, let's hear the opinion of the people on what changes they want to see in Nigeria's health sector.
I think the fundamental changes we need to have is the government allocating more funds to the healthcare sector, especially the primary healthcare. A lot of people are dying because of diseases that should not be a cause for concern. Primary healthcares are underfunded, and it's a major issue.
The changes I would like to see in the health sector, I want the government to give us more awareness to the illiterates and to take care of the old and the elite people, and to equip the hospitals more, most especially for the elderly people.
Many are times when you go to general hospital where the commoners go to, you see that people are being tossed around without getting much needed attention about the time that they need it. So we'd like to see a great change by having enough personnel, by having enough general hospitals around where people can easily go to without delays, and they are able to get care just like it is in advanced country.
It should give us mercy when somebody went to hospital, whether general hospital or teaching hospital. But nowadays, when you went to hospital, they just prescribe for you, then you go and buy at the pharmacy, of which is wrong. I say the Lagos State government said that they are doing free education, free medical services, and it was not so. It wasn't like that. When Jakonde was the governor of Lagos State, when they prescribe a medicine for you, you get it at the pharmacy. But nowadays, that is not at it. So we should do something to it.
We want our leaders to invest more into the health sector, and let there be transparency in the health sector. And also, let there be a good accountability also in the health sector. And also, there should be, as I said earlier on, transparency. Because when there is transparency, our nurses, our doctors, we'll see the effect. They will be well paid, and you see the effect also on the masses.
They should provide a form of health insurance that will be available for all citizens, regardless of the status. So that is even more important than anything. You should provide a kind of a security that will be affordable by all the citizens.
Every city's area must have health centers, health care center. Yeah, but you cannot go to the main hospital. You can still go to your health care center and get treatment, at least for first aid.
There's some hospitals which are there's some hospitals that are not well equipped. Then number 2, provision of drugs, a lot of drugs, and due to the COVID-19 of recent, I feel like they should create more awareness for people on how to the protocols on what to do, symptoms, how does this affect one or two people, the gathering in the hospital, like maybe it's a maximum of 50 or 100 people that they want to be in the hospital so that people will not get affected.
People that are very heady in this country, they are the people that are moving around and working around concerning the economic and all that. So you get like coronavirus, which is a pandemic now. That is still raising in some other countries now, that they should not allow the people from the foreign country to enter the Nigerian country anymore, so that maybe they can give them the stopover, to come into Nigeria, so that one will be reducing the COVID-19 in this country, so that there won't be any problem anymore.
They should give out good medication about hospital, the needs, equipment. They should have good science laboratory, and for like those people that have they used to do operation, surgery, all those that. So that because some people at the end of the day, some people die because there is not enough of equipment, because the government did not provide enough.
Glad to have you back. Earlier in March, the Central Bank of Nigeria initiated a healthcare sector research and development intervention grant scheme to aid research on solutions that could address diseases such as the COVID-19 and other communicable and non-communicable diseases. 5 major healthcare-related research projects are being financed under the initiative.
As we are all aware, the outbreak of the coronavirus pandemic has had an unprecedented effect on the global economy. It highlighted the truth which many of us have always known, that a healthy and safe workforce is critical for continued economic growth as well as stability of our financial system. Developing nations have had to contend with limited supply of vaccines for their citizens. It is therefore imperative that we find ways to encourage research and innovation in the treatment of health conditions for our citizens in Nigeria. As you may be aware, the Health Sector Research and Development Intervention Scheme was introduced with the release of implementation guidelines and subsequent inauguration of the scheme's body of experts in July 2020, chaired by Professor Adeyeye. The scheme, which was part of CBN's policy response to the coronavirus pandemic, aimed at prompting intense research and development activities towards developing vaccines and drugs against the spread of other communicable and non-communicable diseases in our country. Under the Health Sector Research and Development Intervention Scheme, grants are provided to researchers and healthcare institutions for the development of vaccines, drugs, and herbal medicines, which could help curtail the spread of not just only COVID, but also any other communicable or non-communicable diseases in Nigeria. Ladies and gentlemen, following the submission of over 286 proposals from the general public, I'd like to express my profound gratitude to the body of experts for finding time out of their very busy schedules to review and evaluate these proposals. So far, 68 proposals have been evaluated, out of which 5 proposals with significant merits valued at 253.454 million naira were recommended by the body of experts for financing. I see this opportunity to congratulate those that are coming as the first batch: Professor Olufemi Emmanuel Babalola, Dr. Koli Kechukwu, Dr. Garba Ubar, Dr. Ugedengbe, and Dr. Ortega Ejofodomi. I see this opportunity to appeal not just to, because no doubt we have problems of dearth of funding, but I seize the opportunity to appeal to our corporate institutions. You are in medicine, you are in engineering, you are in any area in the sector. You should come together and work with us to develop and fund research and development for the good of our people. We need to encourage our brothers and sisters in the academia so that they can, rather than take flight abroad, they can stay back at home and go straight into research that will help our people. Let me reiterate that the review of proposals is still ongoing, and we expect the committee to provide recommendations for additional award of grants in due course. The CBN has over time emphasized the need for us to move from a consumer-based economy to a more productive-based economy. To this, the bank has developed intervention programs and schemes across various sectors, including the healthcare sector. As part of proactive measures to support the growth of healthcare sector in Nigeria, the CBN introduced the Healthcare Sector Intervention Facility, which is still not fully disbursed today. The facility is aimed at strengthening the sector's capacity to meet the increasing demand for healthcare and products and services, particularly pharmaceutical companies and other healthcare value chain players intending to build or expand capacity. Let me say that everybody will focus on you. They'll be following you, the award recipients, to know how far you have gone in actualizing your research proposals. And I want to wish you well. And because you are just about, I'll say you are the first set of people that are coming on, it is important that you set a pace that others can follow. And please utilize these funds judiciously. They may look small, but at least we begin a journey today.
Let's talk about this grant that has just been awarded. It was meant for research and development of vaccines, drugs, herbal medicines. And two of the grants that were awarded today are on ivermectin that is being proven to be effective against COVID-19. The other two of the 5 are diagnostics, to be able to diagnose, whether somebody has Lassa fever or things like that. In terms of moving forward for vaccines, this is just a reflection of what is going to happen in the next 2 years. There are 2 researchers that are working now on COVID-19 vaccine, because we don't know whether this is going to be a seasonal flu or disease or whatever. So we have to do our own part. But CBN has supported research and development. We are seeing just the output of it. We have not finished our review of the grants, but CBN is also supporting pharmaceutical industry and medical centers because of the weakness that was there for years or for decades. So what CBN is doing is fantastic for the country and is going to move us forward in terms of health security.
Nigeria is a rich nation of green land, rich resources, countless crops and commodities sufficient to feed and provide a means of livelihood for her teeming population. Chin up, Nigeria, the giant of Africa. Exciting times are here. We can be self-reliant and grow our economy if we work together to explore our potential. It takes a whole nation. Let us get involved. Buy Nigerian to grow Nigeria.
That's all on the program this week. Do log on to the website of the Central Bank of Nigeria using www.cbn.gov.ng or locate a CBN branch office near you to find out about the people-oriented financial initiatives of the Apex Bank. Call the CBN contact center using the phone line below for your valid complaints. Remember, local call rates may apply. Send in your comments, contributions to the email address from the CBN@gmail.com and follow us on the social media for updates and uploaded episodes of the program. I am Liye Misidada. Stay safe.